each month, Ascent Care Partners sends charges in the form of CPT codes on a spreadsheet to the practice billers, either in-house or outsourced. From there, the practice billers drop the charges on encounters as they would for any other service. Ascent Care Partners charges 55% of the local Medicare fee schedule for billable CPT codes. Usually, practices will see a 36 to 40% profit margin on our services. Our services make sense from a financial standpoint due to the fact that our dedicated service team spends a minimum of 45 minutes a month per patient, creating a larger revenue pie that more than makes up for the split relative to in-house options. When encountering new opportunities, Ascent Care Partners often receives questions regarding the 55% fee cost. We arrive at this figure due to bearing a full staff cost structure in which we have enrollment specialists, retainment specialists to avoid patient leakage and missed months, as well as a full administrative staff that receives calls taking wage and labor burden off our client practices. In addition, our leadership team is able to provide certain management guidance above and beyond, giving additional value to our services. As a whole, because our volumes of patients that we deliver to practices is far higher than practices could achieve on their own with software-only solutions, the 55% fee is almost always accompanied by a far greater final revenue net profit for our practices. With regards to timing of cash flow, Ascent Care Partners delivers charges to the practice at the end of a given month or the beginning of the next month following the date of service. So, for example, for dates of service in January, Ascent Care Partners submit charges to the practice within the first 10 days of the month, with practice reimbursement usually beginning at 14 days after claims submission. So for services provided in January, practices will receive revenue from insurance companies near the end of February, and Ascent Care Partners invoicing will be due in early March. Ascent Care Partners occasionally sees denials on submitted CCM and RPM claims due to the following reasons. Number one, the patient was in hospice care or in inpatient services relative to the date of service submitted. Number two, Medicare has made a local coverage determination processing error. Or number three, the billed date of service for CCM or RPM services matched an in-office encounter date of service. With regards to assumption of risk for non-payment of claims, Ascent Care Partners shares in the risk with the practice in that for a large percentage of denials that are not workable and not due to biller error, Ascent Care Partners does issue credits to the practice for these denials. Ascent Care Partners understands that physician offices are not created equal when it comes to basic principles of cost accounting, profit loss, and other financial considerations. To that end, Ascent Care Partners has an experienced leadership team that is willing to assist, support, explain, and provide knowledge to physicians so that physicians have a firm grasp of these accounting and profit loss revenue expense principles.